Hello, my name is Stacy Ward. I'm a Crisis and Family Support Counselor for PWSA, USA. In this video, we will discuss practical tips and effective strategies parents and caregivers of people with Prader-Willi syndrome can use to prevent and reduce challenging behaviors. You will learn a working definition of behavior, the importance of communication, the value of structure and routine, managing expectations, the benefit of planning, your role in creating positive behavioral outcomes, the power of praise and positive reinforcement, how to respond to a behavioral crisis, and tips for single parents, separated divorced parents, and those starting a home behavioral support plan for the first time. Let's take a moment to talk about behavior generally. The definition of behavior is anything an organism does in response to action or stimulation. This definition does not imply whether behavior is good or bad. It just is. Behavior is a function of living for all of us. Good behavior doesn't get much attention because it doesn't cause problems. However, when behavior causes a problem, it's labeled bad, and it becomes a focus of attention with the goal usually to fix it. People with PWS are not the only ones who engage in challenging or unsafe behaviors. We all do it from time to time. Picture for a moment that you're driving to work and running a few minutes late. The car in front of you is driving 10 miles under the speed limit. Do you tailgate? Do you lay on your horn? Do you yell, "Drive faster," knowing that they can't hear you? These three actions, if done by your child, would be viewed as problematic behaviors. However, when we engage in them ourselves, we justify our actions as being okay because we are running late, we are frustrated, and they are driving too slow. When we do these things, we rarely have someone say to us, "Stop doing that. Your behavior is not appropriate," unless, of course, your significant other's in the car with you. My point is, we view our child's challenging moments differently than ours, and we shouldn't. Behavior is often a means of communication. For example, when you yell and beep your horn at a driver, you communicate that you don't want to be late. When your child has a meltdown, she may be communicating that she's tired or frustrated, or that he may not want to leave before finishing an activity. When you see an unwanted behavior occur, approach it with a sense of curiosity by asking the question, what's really going on here? What is my child trying to tell me? This approach helps in two crucial ways. By focusing on what the behavior is communicating, it is easier not to take that behavior personally. And it immediately takes you from frustration to problem solving because you're looking at the why, not the what in the behavior. So far, we've learned that behavior is part of life. We've also learned that we all engage in behaviors, including those others may label challenging. And finally, we learned that behavior is a means of communicating something. Finding out what a behavior communicates is the key to reducing or preventing that behavior in the future. Positive behavior support is an essential tool for all caregivers of a person with Prader-Willi syndrome. It is best to implement positive behavioral strategies early in a child's life, even before behavioral challenges emerge. It is an important proactive and preventative step to become familiar with and implement positive behavioral strategies. A positive behavioral strategy can help decrease tantrums, diminish persevetive and OCD-like behaviors, increase cooperation and effective transitions through activities and portions of the day. A positive behavior support strategy uses a person's strengths and interests to help motivate them to achieve non-preferred goals and activities. It is a way to do some behavioral problem solving in a fun, creative, and effective way. Examples of positive behavior intervention plans include token economies, earning tokens for appropriate wanted behavior that get exchanged for a larger reinforcer. Points and level systems. Different levels represent varying levels of independence and privileges. Points are earned for appropriate wanted behavior. The tips and strategies I will now share are important elements to include in your positive behavioral support planning. Children with PWS respond exceptionally well to structure and routines. Create a routine for your family, not just your child with PWS. Your child may respond well to a visual schedule as well. The structure allows them to know what to expect and to feel safe. Build some time into your routine every day to spend some individual one-to-one time with your child, doing something that's important to them. It could be reading a story together, completing a puzzle, playing with a favorite toy. The amount of time spent doing this is not as important as your full engagement and attention. If possible, schedule this time together immediately following a less preferred activity. This accomplishes two things. It gives your child something to look forward to, and it's an immediate reward for completing a task that may be challenging for them or just one that they don't enjoy. We all know that from time to time, the routine has to change for one reason or another. It's crucial that you preset your child when this occurs. How early you can inform your child varies from child to child. For some children, too much notice of a change will increase their anxiety and cause upset. For others, the more notice and involvement in the decision, the better. You know your child best. In addition to developing structure and routine, it's important to also develop appropriate expectations for your child. These expectations or rules should be consistent, and your child should know what they are. Enforcing these consistently will provide your child with a sense of security, similar to the routine and structure of the day. Developing household rules rather than rules that only apply to your child with PWS are more effective. Many children with PWS have a strong sense of fairness and will perceive rules that only apply to them as being unfair. If the rules or expectations for your other children are different, make sure everyone in the family knows what they are and why. For example, Johnny's bedtime is 7:30, but Ella's bedtime is 8. Because Ella's older. When Johnny is older, his bedtime will be 8. Know how you're going to react and be consistent in your reaction when your child does not follow the rules or meet your expectations, which will happen. If yes means yes and no sometimes means yes, especially if they keep asking you, your child is not going to know what to expect. They will learn that if they perseverate long enough, you will give in and say yes. And let's face it, kids with PWS are experts in perseveration. Decide along with any other authority figures in your house what the expectations are and how you will respond when faced with situations, and be consistent. Respond with firmness, validate their feelings, and provide them with choices when possible. Many children, not just those diagnosed with Prader-Willi syndrome, need help identifying their feelings and emotions. Use phrases such as, "You seem sad that you won't be able to play with your friend anymore. Are you sad?" Validate the feeling. It's okay to feel sad. I get sad when I have to say goodbye to my friend too. Use books and favorite television shows to identify how people are feeling based on their facial expressions. It can be fun to practice the different facial expressions one makes when they're feeling sad or happy or mad, or any of the other emotions when your child's calm. Taking the time to develop the words that describe their feelings will help your child identify how they're feeling and articulate it with words rather than actions in the future. Model the behavior that you want your child to learn. How many of us have looked at our children and thought to ourselves, "They learned that from me," or "She gets that from her father"? Our children are learning from us whether we want them to or not. Let's be sure we're taking the time to teach them the behaviors that we want to see. When you're frustrated, take a deep breath rather than yell. Count to 10, or build in a sensory break for yourself. When you utilize your coping skills, tell your child what you're doing. Mommy's frustrated with this crossword puzzle, so I'm going to put it away and do something else for now. I had a difficult day at work. I'm going to go for a run to make myself feel better. When your child sees you using appropriate coping mechanisms, they are more likely to develop and use them. The next strategy I want to talk about is anticipating challenges and planning accordingly. If you know that your child gets fatigued in the afternoon, schedule doctor's appointments or therapy sessions for the morning. If your child is upset by loud noises or crowds and you're attending a school concert, bring headphones or arrive early and choose your seating closest to the exit in case you need to leave quickly. Always have a plan B for every situation, even if you think you won't need it, and sometimes a plan C. Remove temptations for any environment that you can control. When visiting family, ask that they remove visible food and refrain from eating in front of your child. If that is not possible, try to plan visits at your house where food security already exists. The most successful strategy for preventing challenging behaviors is praise your child often and sincerely. Using a 5-to-1 ratio of positive to negative interactions is ideal. Reinforce steps in the right direction and be specific. For example, "You did a great job putting your shoes in the closet. Thank you." Or "Walking up the hill is really hard for you, and today you walked halfway all by yourself. That was great. I'm so proud of you." Use your attention and time as a means to reward your child for positive behavior. Praising your child not only helps to reinforce what you would like to see, it reminds you as the parent of all the wonderful attributes your child has, and the attributes definitely outweigh the challenges. Even if you use all these proactive positive behavioral strategies at home, your child is going to have difficult moments. Keep in mind, not every behavior is related to the syndrome. If you have other children who do not have PWS, you know that all children have challenging moments. Now let's talk about what to do when your child is in full meltdown mode. When your child is in full meltdown mode, your reaction and response is critical. Let's first make sure everyone is safe. If there is a danger present, remove it. For example, a coffee table or a chair. It may be easier to move other people and furniture out of the way than it is to remove your child from the area. If your child is a danger to you, themselves, or others, call 911 or your local mobile crisis unit for assistance. Safety always comes first. If your child and everyone around your child is safe, remain emotionally neutral and let it play itself out. Some children will tear up books, cry, stamp their feet, and then fall asleep. Others will apologize and want hugs after the tantrum. Don't deny them. Give them a hug. Validate their feelings, not the behavior. During the tantrum, keep a close eye on your child while trying to look disinterested and engaged in something else. Having a magazine or your phone handy to feign interest will make it a little easier for you. Stay calm during the meltdown. This is not the time to talk to your child, nor try to pull them out of the emotional state they are in. They won't be able to process what you're saying effectively, and often it will escalate the situation. Do not give in to the tantrum. If you do, your child will learn that tantrums are the way to get what they want. Once your child calms, have them help you clean up the mess that they made. Natural consequences are most effective. Your child threw their toy and it broke. They no longer have that toy to play with. Punishment, such as taking a play date scheduled for next week away, is rarely effective. Children with PWS have difficulty connecting the two events as cause and effect. If your child is emotionally unstable, canceling plans for that day is certainly appropriate. I do not believe that spanking is an appropriate form of discipline for any child, but it is certainly not helpful for a child with Prader-Willi syndrome. For parents who are separated or divorced, co-parenting a child with PWS can have additional challenges. Communication between parents and a mutually consistent approach to behavior is critical when preventing and managing challenging behaviors. People with PWS often have difficulty with transitions and require presetting and reassurance. Visitation schedules should be concrete to minimize anxiety, and all changes should be communicated to your child in advance whenever possible. Having the same routine at both households, consistent meal times, and following the same nutritional approach will decrease the likelihood of behavioral challenges. When your child does have a meltdown or experiences behavioral challenges, communicate all the details to the other parent. If this kind of consistency is not possible in both homes, then make sure it is in your home. Single parents also face additional challenges when parenting a child with PWS. It's important to take care of yourself emotionally, physically, and spiritually. Develop a support system comprised of people you trust who can provide you with an outlet and scheduled me time. You cannot be your best parent to your child without taking care of yourself. Reach out for support from family and friends. Identify people who are willing to learn the behavioral support needs of your child so they can provide child care while you have some time for yourself. See if respite care and in-home behavioral support services are available for your child. Connect with other parents in the PWS community through social media and attending local PWSA chapter meetings. Isolation is frequently an issue for single parents, so connecting with others is crucial. Finally, establish the kind of structure we've discussed so you're preventing and minimizing behavioral challenges. If you are just beginning to put together a positive behavior support plan at home, the important thing is to just start. Don't try to address everything at once. Instead, identify one or two of the most disruptive behaviors you want to diminish and develop a plan to address those specifically. Keep in mind that if you are introducing a structured behavioral plan for the first time, your child is likely to resist the change. But in time, they will adjust because healthy and consistent structure is what a person with Prader-Willi syndrome needs. Once your initial plan is working, then you can expand the plan to address additional issues. If this all feels completely new to you and you don't know where to start, let's look at starting a behavior plan and what that looks like. You have identified crying and refusing to put his toys away as the problematic behavior that you would like to change. Your goal is to decrease the crying and increase cleaning up his toys. Post a sticker chart and explain to your child that he can earn a sticker every time he puts his toys away without crying. Depending on the age of your child, the sticker may be enough of an incentive. For older children, the sticker should add up to earn an additional incentive. One-to-one time with mom, a new book, extra TV time. Use what's motivating for your child. Now it's time to implement what we've learned. Set a timer and tell your child firmly that in 5 minutes it will be time to clean up his toys. When he tries to negotiate for more time, stay firm and calmly repeat 5 more minutes. Tell him at the 2-minute mark that he has 2 minutes of playtime left, and then again at the 1-minute mark. When the timer goes off, tell him it's time to clean up. Offering to help pick up his toys may be helpful. If he immediately starts to clean up his toys, provide lots of verbal praise to encourage him to continue. Great job, you're doing it. Once the toys are put away, have him pick out a sticker and put it on the chart with your supervision. Keep in mind, it's not always going to be that easy. When he resists, remain firm and do not give in. If he does not earn the sticker, Remind him that he can earn one the next time he plays with his toys and cleans them up without crying. The good news is behavior management can be learned. We encourage you to take advantage of every opportunity to learn more about behavioral strategies through reading, attending PWSA USA's National Convention, participating in your local chapter meetings, and participating in PWSA USA webinars on positive behavioral support. In addition, even if it's not PWS specific, look for other opportunities to learn about behavior. The more tools in your toolbox, the better. If you are struggling to deal with your child's challenging behaviors, call PWSA USA at 800-926-4797 and ask to speak with a family support counselor. A family support counselor can help you determine the function of your child's behavior and develop a positive behavioral intervention plan.